PCOS explained simply, from symptoms to solutions. If you've ever wondered why your period is all over the place, why your skin is breaking out again like you're a teenager, or why you're gaining weight even though you're not doing anything wrong, you are absolutely not alone. Many women quietly struggle with the same questions, and for a lot of them, the answer turns out to be PCOS, polycystic ovary syndrome. PCOS is one of the most common hormone conditions in women of reproductive age. It can affect your periods, your weight, your skin, your fertility, and even your mood. The good news? It's manageable. Once you understand what's happening in your body, there are real, practical steps you can take to feel better and protect your long-term health. What exactly is PCOS? Let's start with a simple explanation. Your ovaries are part of your reproductive system. In a typical cycle, they help mature and release an egg each month and produce hormones like estrogen and progesterone. With PCOS, this system doesn't run as smoothly as it should. In many women with PCOS, the body makes higher levels of androgens, hormones often thought of as male hormones, like testosterone, although women naturally have them too. At the same time, the body may not handle insulin properly, which affects blood sugar. This combination can disrupt ovulation, meaning the ovaries don't release an egg regularly or at all. On an ultrasound, the ovaries may show many small, immature follicles around the edges. These are often called cysts, but they're really tiny, fluid-filled sacs containing eggs that didn't fully mature. That's where the term polycystic comes from. It's important to know that you can have PCOS even if no cysts are seen on your ovaries. And having cysts alone doesn't automatically mean you have PCOS. Doctors look at the full picture: your symptoms, your hormones, and sometimes your ultrasound. Now, why does PCOS happen in the first place? The honest answer is that there isn't one single cause. It's more like a mix of factors coming together. First, there's a strong genetic component. PCOS tends to run in families. Maybe your mother, sister, aunt, or grandmother had irregular periods, facial hair, or fertility struggles that were never really explained. That family pattern can hint at a higher risk. Second, many women with PCOS have something called insulin resistance. That means their cells don't respond well to insulin, the hormone that helps move sugar from the blood into the cells. To compensate, the body makes more insulin, and that extra insulin can signal the ovaries to produce more androgens. Those higher androgen levels can lead to symptoms like acne, extra hair growth, scalp hair thinning, and irregular ovulation. Weight and lifestyle can influence how strongly PCOS shows up, but they are not the root cause. You did not cause your PCOS by eating a certain way or not being perfect with exercise. It's a medical condition, not a personal failure. PCOS can look a little different in every woman, which is one reason it can be confusing and sometimes missed for years. Still, there are some common patterns. Many women notice changes in their menstrual cycle. Periods might become less frequent, coming every 6 or 8 weeks instead of monthly, or they might stop for several months at a time. When they do come, they can be heavier or lighter than usual. All of this is related to irregular or absent ovulation. Skin and hair changes are also common. Higher androgen levels can cause persistent acne, especially along the jawline and lower face, or very oily skin. Some women develop unwanted hair growth on the chin, upper lip, chest, or belly, while at the same time noticing that the hair on their head feels thinner or sheds more than before. Weight can be another piece of the puzzle. Many women with PCOS find they gain weight more easily, particularly around the abdomen, and that losing weight feels much harder than it should given their efforts. This can be incredibly frustrating and emotionally draining. There are also quieter signs. Some women develop small skin tags or darkened, velvety patches of skin around the neck, armpits, or under the breasts, which can be a sign of insulin resistance. Tiredness, low energy, and mood changes are also very common. None of these symptoms alone prove PCOS, but together they create a pattern that's worth discussing with a healthcare provider. If you recognize yourself in these symptoms, the next step is getting properly evaluated. Diagnosis usually starts with a detailed conversation and a physical exam. Your healthcare provider will ask about your periods, any changes in your skin and hair, your weight history, your family history, and how you've been feeling emotionally. In adults, many doctors use a set of criteria that look for at least 2 of 3 main features: irregular or absent ovulation, often seen as irregular periods; signs of higher androgens, like extra hair growth, acne, or elevated androgen levels in blood tests; and ovaries that look polycystic on ultrasound. You don't necessarily need all 3 to be diagnosed. Blood tests often play a big role. They can check hormone levels, rule out other causes of irregular cycles, and look at blood sugar, insulin, and cholesterol. A pelvic ultrasound may be done to see the size and appearance of the ovaries and the thickness of the uterine lining. Your provider will usually also consider and rule out other conditions that can mimic PCOS, such as thyroid problems or high prolactin levels. If you feel your concerns are brushed aside, it's okay to ask more questions, request a clearer explanation, or even seek a second opinion. You deserve to be taken seriously and to understand what's going on in your body. PCOS and long-term health. PCOS is more than just a period problem. It's a condition that can affect your whole body over time, which is why early awareness and monitoring are so important. Because PCOS is often linked with insulin resistance, women with this condition have a higher risk of developing pre-diabetes and type 2 diabetes later in life. There's also an increased chance of high blood pressure and unhealthy cholesterol levels, all of which can contribute to heart disease over the long term. If periods are very infrequent or absent, the lining of the uterus may build up too thick, which can lead to heavy bleeding and, over many years, a higher risk of certain changes in the uterine lining. This might sound worrying, but it's actually empowering information. These risks are not guaranteed outcomes. They are signals to pay attention. Regular checkups, blood tests, and a thoughtful treatment plan can significantly lower these risks and help you stay healthy for the long run. Lifestyle strategies that truly help. Lifestyle changes can feel like a cliché, but with PCOS, the right realistic adjustments can make a very real difference. The key is to think in terms of support, not punishment. When it comes to food, there is no single PCOS diet that works for everyone. Instead, focus on building balanced meals. Try to include a source of protein and healthy fats with your carbohydrates so that your blood sugar rises more gently. This could mean pairing fruit with yogurt or nuts, choosing whole grains more often than refined ones, and making room on your plate for vegetables and fiber-rich foods. You don't have to be perfect. Consistency matters more than strict rules. Movement is another powerful tool. You don't need to live at the gym. Walking, light jogging, cycling, dancing, swimming, or simple strength exercises at home can all help your body use insulin more effectively. Aim for regular activity most days of the week, but be kind to yourself if some days don't go as planned. Sleep and stress are often overlooked, but very important. Poor sleep and chronic stress can make cravings worse and make it harder to manage weight and hormones. Building a calming bedtime routine, taking a few minutes for deep breathing or stretching, and setting small boundaries around your time and energy can all help support your hormonal health. Tiny, sustainable changes add up. You don't have to overhaul your life overnight to move in a healthier direction. Medical treatments, from symptom relief to fertility support. Even with the best lifestyle habits, many women with PCOS benefit from medical treatments as well. The right plan depends heavily on your symptoms and your goals, especially when it comes to pregnancy. If pregnancy is not something you're planning right now, your doctor may suggest hormonal birth control, such as the pill, patch, ring, or some types of IUD. These methods can regulate or control your cycles, reduce menstrual pain, help protect the uterine lining, and often improve acne and excess hair over time. Medications like metformin, which help the body respond better to insulin, may also be considered. For some women, metformin can help with blood sugar control, weight management, and sometimes more regular periods. When symptoms like excess hair growth and acne significantly affect confidence and quality of life, anti-androgen medications, topical treatments, and cosmetic options like laser hair removal may be discussed. These are not vain concerns. Feeling comfortable in your own skin matters. If you do want to get pregnant, your treatment plan will look different. Doctors may use medicines to stimulate ovulation, helping your ovaries release an egg. In some cases, additional fertility treatments, such as injections or IVF, may be recommended. Always remember, This is general information. Any decisions about medication should be made together with your healthcare provider based on your individual situation. PCOS and pregnancy. Hearing that PCOS is a common cause of ovulation problems can be scary, especially if you dream of having children. But it's important to put that information in context. PCOS is also one of the most treatable causes of fertility challenges. Many women with PCOS do become pregnant, some after making lifestyle changes that support ovulation, and others with the help of medications that encourage the ovaries to release an egg. Fertility specialists and OB/GYNs work with women every day who have PCOS and want to conceive. During pregnancy, women with PCOS may be monitored more closely for conditions like gestational diabetes or high blood pressure. But with proper care, many have healthy pregnancies and healthy babies. So while PCOS may shape the journey to pregnancy, it rarely closes the door. If motherhood is something you want, it's worth having an open, honest discussion with your provider about your options and timing. Emotional wellness, body image, and mental health. PCOS doesn't just affect your lab results or your ultrasound report, it affects how you feel about yourself. Dealing with irregular periods, acne, weight changes, unwanted hair, and fertility worries can be emotionally exhausting. Many women with PCOS experience anxiety, low mood, or depression, and may feel ashamed or broken, even though they've done nothing wrong. Taking care of your mental and emotional health is just as important as managing hormones and blood sugar. Talking to a therapist, especially someone who understands chronic conditions or fertility issues, can be incredibly helpful. Support groups and online communities can provide a sense of connection and understanding that you may not find in your everyday life. Simple practices like journaling, setting boundaries around people's comments about your body or fertility, and celebrating small wins can also make a big difference. Your value is not defined by your weight, your skin, or your ability to conceive. Clearing up a few PCOS myths. Because PCOS is so common, there is also a lot of misinformation. A few quick clarifications can help. PCOS does not only affect women who are overweight, women in all body sizes and shapes can have it. Weight can influence symptoms, but it is not the whole story. PCOS does not automatically mean you will never get pregnant. Many women with PCOS do conceive, with time, and sometimes with medical support. And finally, you can have PCOS even if your ultrasound doesn't show obvious cysts, because diagnosis is based on a combination of features, not just one image. How to advocate for yourself in the healthcare system. Unfortunately, many women spend years being told their symptoms are normal, just stress, or just weight. Learning to speak up for yourself is a powerful part of managing PCOS. Keeping track of your periods, symptoms, and questions in a notebook or app can help you walk into appointments prepared. Don't be afraid to ask, what are you looking for with these tests? Or, how did you arrive at this diagnosis? If you feel dismissed or ignored, it's okay to seek another provider who listens and explains. Living well with PCOS. A hopeful wrap-up. PCOS is common, complex, and sometimes overwhelming, but it is not the end of your story. It's a condition you can learn about, manage, and live well with. By combining realistic lifestyle changes, appropriate medical care, emotional support, and self-advocacy, many women see real improvements in their symptoms and protect their long-term health. If you see yourself in anything you've heard today, know this: you are not alone, you are not to blame, and you absolutely deserve compassionate, informed care on this journey.